Hi, everyone. I'm Dr. Don Barden. I'm a scholar of economics and human behavior. And if you're watching this video, it's because you clicked on the link to learn about something called ArchitectHer for dentistry. I thought I'd spend a few minutes sharing that with you. You see, most of the world knows me as an expert in human behavior and economics, and that's true. But I've got a little subspecialty that only the people in dentistry know about, and that is I have served over 560 dental practices around the world: the United States, Canada, Europe, New Zealand, Australia, even Asia. And they all have one thing in common, and that is the world is changing. And it's changing for the good, because that's the other subspecialty. Dentistry is shifting very much ahead of the rest of the world into what we call the new level of economics, the new world, what's happening. And it's really special. You see, we call this new term that's occurring the human economy. And the human economy is going to be led by one special group of people. And dentistry is at the very tip of that sphere. And those special people, well, frankly, is you, it's women. You see, we know without a shadow of doubt in the year 2028, which isn't that far away, that the global leadership will shift from the old patriarchal male system to a world run and controlled by women. And that's a great thing. In fact, it's so great, all the data points, that we're going to have a 3x, 300% growth in the economy because of that. Now you think to yourself, what does that mean? How does that affect me? Well, let me tell you, it affects you a lot, because dentistry is the very tip of that sphere. We've gone from dental schools being almost heavily male dominated to almost completely female dominated now. We have consumers, both male and female, saying that they want a female dentist. We have practices that are growing right and left. And the common denominator for that is women. It is run and led by women. In fact, to go a little bit deeper, I can take a practice run by a man and put a female practice right beside his. And guess what, ladies? You will outperform production revenue 300% to that of a man in the same 1 year time period. More importantly, your profits will be 3 times greater than the guys. You want to go deeper? Yeah. Patient retention and employee retention doubles that of a man over the same period of time. So what does that mean? It means that women are not only about to take over all of global leadership, it's going to dominate dentistry. So as a woman who is in the dental industry, you either own a practice or you're managing several practices or whatever it is, it doesn't matter. But your time is come, it's now. So we've spent the past 5 years doing a very, very deep dive on what it is that's going to make this phenomenon so special. And it's not just women, it's what you ladies do differently. It's how you manage people. What is it that makes your revenue 3 times more than that of a guy's? What is it that makes your employees stay twice as long? And dig this is so important. A female employee will stay twice as long as if that same employee, man or woman, was working for a male doctor. But guess what? Under your tutelage, their production actually increases in those latter years. So it's not like they're just hanging around getting a free paycheck. They're actually growing themselves, and they're growing the production of the practice. So what does that tell us? It tells us that everything is about to change for such a good and important way, that my question to you would be, what are you doing to be prepared? Now, we put this out in front of a lot of female dentists and said, what can we do to help you? How can we serve you? And undeniably, the truth came back. The truth's really simple. There really isn't a place where women can go as professionals, as doctors in the dental industry, and be around other women, and only other women that are in the same boat as you are, that are struggling, looking at the future and saying, oh my gosh, interesting point. A female doctor, dentist, business owner juggles 297% more things up in the air than her male counterpart does. You're dealing with yourself, you're dealing with practice, you're dealing with the clinical side of it, you're dealing with home and family, maybe kids, the community, aging parents. The list goes on and on, but you're doing it with grace. So what we did for 5 years was we studied you. We studied women like you all over the world, over 5,000 subjects. We came up with a conclusion. Not only mathematically are you going to take over the world pretty soon, But that change, that impact you're going to have is so dramatic. We had to ask ourselves a simple question. Okay, ladies, how do you do it? And now we know. We've spent so much time studying the methodology, so much time looking at what these high-performing women are doing differently, while they're reducing their stress, reducing that overload and burden, while they're spending more time doing things they love. In other words, they're making more, serving more, while they're working less. But we know why now. We know that secret sauce. And it was published recently in a book, which was number one on Amazon in the economics category for 15 weeks. It's called Here Come the Girls. If you want a free copy of it, just send me a note here and we'll chat and I'll be happy to share it with you. But at the end of the day, we know the methods. We know what you do. We know how you speak to your team. We know what it is that empowers your team to do things that, frankly, working for a traditional male practice isn't going to happen. We now have the secret sauce. But more importantly, this formation, this structure that you've created is kind of blind to the world. The world doesn't see you and you don't see the world. So what we've been able to do in our study is throw a blanket over it and allow you to see that form and see that structure. In other words, we've put organization around sometimes what you might feel is just obvious, but it's not. So what we've done at your request is we've created a special event called ArchitectHer for Dentistry. Now, this is a group of only women who are just like you. You own your own practice, you're working your way up, maybe you're a senior associate, but everything about you says that you want to be in control and lead something one day. While you're working less, but making more. While you're serving the community, but while you're making a bigger impact. While your family sees generational output on things. How just one person can come up to you one day at the store and say, hey, doctor, you know what? You might not remember me, but a couple years ago, you did this full mouth replacement for me, and I haven't stopped smiling since. My confidence is up, and I don't know if I said thank you when it happened, but I want to say thank you now. All of those things are happening in a world that is changing dramatically and literally calling out for you. So, because you've asked for it, we have created ArchitectHer for Dentistry. Now, what this means is you come together with 30 other women just like you, peers. And we're doing it in Miami, and the first cohort starts in December. And what happens is you'll meet every 90 days for a day and a half, and you will be blown away. In that first full day, you're in a very elegant, wonderful classroom setting. It is not a typical hotel conference room, I promise you. But you'll be in an amazing setting where you can just really just focus on you and your practice and what it is. How do you change the way you think about your thinking? How do you look at life differently? How do you take all of this experience that you've accumulated over the years and now put it to action in a time where the market, the economy, your patients, your workers, men and women are all crying out for you going, we're here, help us. That's what we do. We allow you access to some of the greatest teachers in the world, someone that you're going to be with the whole time, and a group of peers that you will be able to collaborate with. You'll be able to share ideas with. You'll be able to basically complain about together. You can do whatever you want because it is a safe and no judgment zone. And it lasts all day. And I promise you, you will walk away every time going, wow, what just happened to me? I've never seen this articulated in such a way that makes sense. You will have aha moments that allows you to look differently at the future, everything you want and desire, and how it is that you're going to accomplish it. Then you go out to dinner that night, hopefully with some new friends, people you might meet, or just go by yourself and relax. It's kind of in a really cool spot down there, by the way, a place that everybody dreams of going. And you're going to walk away from there and you're going to go, wow, I just need to breathe and take this in before I go back tomorrow. Then you come back for the second day, and that's where the magic happens. You see, the second day is about your identity. The second day is taught by female experts who will be talking to you in the group, and you'll feel like they're literally only talking to you. But they talk about how you spend so much time on the outside, so much time serving and helping others, so much time running your practice. What are you doing to help yourself as a whole woman? What are you doing to understand exactly what it is that you need to do to be your best self? How do you allow the work and the effort that you put into other people to bounce back and you feel not only the reflection, but the warmth of your own self? That's coming the next day. No, it's not weird. It's not woo-woo. It's nothing. It's just an honest talk to you by some of the best doctors in the world, not dentist doctors, but neuroscientists and behavioral specialists like myself, but only women on day 2. But when you're talking to them and you're in that class, you're going to go, wow, this is what I've been looking for as a woman leading into the future. You do that every 90 days. You come back for a year and you get to explore and think and build upon processes that will make you think differently about your practice. I promise you, you will not sell out. Or if you want to sell, if you want to be a part of one of these big corporate momentums, it's not working very well, by the way. But when you do say, look, I'm tapping out, it's time for me to walk away, I'm done. Guess what? You're going to have one heck of a choice in front of you. Because what we really want for you in the future, number one, is for you to be happy, like giggly happy with yourself. But second, we want you to be at such peace and harmony that when some opportunities do present themselves to you, you have a choice. And neither one of the decisions around either choice is wrong. In fact, they're both right. You might look at it and go, why would I ever step away from this? I'm making money. I'm working less than I've ever worked. I'm making a significant impact and my valuation keeps growing every day. Why would I leave this? I love what I'm doing and I'm in total control of my schedule and my income. That's a great place to be. Or because of what you've achieved, the buyer, could be another private practice, could be corporate, who knows, probably gonna be private. They're gonna look at you and go, wow, how big of a check can I write? Because we want to be a part of this. And you might take it. But either way, you have your choice to keep it or to sell it, to continue on and pass it on, or to just enjoy life. Whatever you want to do, it is at your disposal. ArchitectHer for Dentistry is designed for you. It's about women coming together to explore ideas around this. Now you're saying, hey, Dr. Martin, you're a dude. Yeah, I know. I've noticed that. And I have 3 boys. But I do have a beautiful granddaughter. And I can tell you one thing's for sure. From my perspective, science is science. I spent 25 years on Wall Street as a top performer. I've owned my own consulting firms. I've traveled around the world probably 10 or 12 times working with people just like you. And it's time to share that with you in ways that, let me just be blunt, it will change your life. So I'm inviting you to do this, but it starts with a phone call. Click on the button and say, hey, I'd love to chat with you. Let's talk. It'll be me. I'll talk to you we'll spend about 30, 45 minutes, whatever time you got. And I get your world. I understand dentistry. It might be at 7 o'clock at night. It might be at 5 in the morning as you're going in. Whatever the time is, I will make it work for you. But we're looking for you to come and raise your hand and say, yeah, I want to be part of this movement. I want to be a part of something so special that it's not only changing the dynamics of an industry, it's changing the world. And you're at the very tip of that spear. So this is me inviting you to explore something that you might not have ever seen before. And when you do, you're going to see what I'm talking about. ArchitectHer for Dentistry is the only thing like that in the world. It's curated, it's special. It's in Miami. It's on a Friday and Saturday, so you don't take away production time. Spend the weekend if you want. Enjoy, have fun. But most importantly, I promise you, this is like nothing you've ever seen before. You'll understand the dynamics of the economy. You'll understand how to communicate better with your team. You'll understand how to double your conversion rate on treatment plans. You'll understand how to run the business in such an effective way that you're going to be just giggly excited. Things that you might not have been asked about, even as simple as balance sheets and spreadsheets, things that are just, ugh, we make it fun and exciting. I promise you. But in the end of the day, this is about how you think. And your ability to look forward with an incredible amount of ambition and enthusiasm changes the dynamics of everything. So let me ask you, it is going to happen. Women are about to run everything. So the question is simple. What are you doing to be prepared? I'd like for you to explore this. So click on the button below and give us a call, or tell us when you want to have a call, and I'll make it happen. I promise you. I'm Dr. John Barton. I'm a scholar of economics and human behavior, and especially dentistry and women in leadership. The time's now, and I want to share this with you. I look forward to hearing from you.